What happens to your belly button during a tummy tuck? So there's two ways to deal with the belly button during a tummy tuck. I should say three ways for that matter. So let's talk about three ways that we can deal with your belly button during a tummy tuck. So if you're having a mini abdominoplasty, oftentimes we don't have to do anything to the belly button. The belly button stays attached to the same skin around the top that you can see and feel, as well as it remains attached to the muscle layer underneath. So one option is your belly button doesn't get manipulated at all. The next option is an umbilical float. So if you have just a little bit of skin above your belly button, a little bit of extra loose skin between your breastbone and your belly button, we can do what's called an umbilical float. So there's no incision around your belly button, but we cut the stock underneath, which attaches your belly button to the muscle layer. And then to tighten up that loose skin above your belly button, we pull the belly button down or float it down a couple centimeters to get the skin above your belly button tight. But by only floating it down a couple centimeters, if that's all you need, your belly button looks okay. It doesn't look abnormal. Now, if you have a lot of loose skin above your belly button, you shouldn't do an umbilical float, because what would happen is to tighten up the skin between your breastbone and your belly button, if there's a lot of loose skin there, if we do an umbilical float, your belly button's gonna end up way too low on your abdomen in order to tighten up all that skin. So the third option to take care of the belly button during a tummy tuck is to do what's called an umbilical transposition. So this is where we leave the belly button attached to the muscle layer underneath. So the stalk of the belly button remains attached, but we make an incision around the belly button, which leaves a hole on top and your belly button underneath. That hole gets pulled way down with the tummy tuck, and once your skin's tight, whatever skin is sitting on top of your belly button after the skin's pulled tight, we make a new little hole there and sew the belly button underneath to that new hole that we made in your skin. So think of it like a button. The button remains attached underneath, and we pull the fabric, which is your abdominal skin, tight, and then we have to make a new little buttonhole for the button to come out. So that is an umbilical transposition. And most patients who get an abdominoplasty have an umbilical transposition, because it is the only way to tighten up the skin above the belly button and not have the belly button move too far down the abdomen. So the umbilical transposition is what most people need. The umbilical float is what few people need, and that's only really reserved for people who have a little bit of extra skin above the belly button between their breastbone and the belly button. And then it's very rare if someone's gonna get a tummy tuck and go through that they don't need anything manipulated that involves the belly button. So I hope that makes sense, what happens to my belly button during a tummy tuck. The last thing I wanna say is to keep the belly button alive, we have to leave it either attached to the muscle layer with its stalk, or it has to remain attached to the skin around it, the skin that you can see and feel right now. We can't cut around it and cut the stalk all at the same time, because the belly button would die. So it has to remain attached to one or the other. So that's why we can either transpose it, keep it alive via the umbilical stalk, or we can float it, which keeps it alive based on the skin around the belly button, the skin that you can see and feel right now. Hope that makes sense. If you have any questions, let us know. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page, and our SpeakPipe is located there. Thanks for listening.